So psychiatry and even psychology can often ignore the spiritual aspects of, human nature. But many people find that spirituality can really be helpful for them in terms of like anxiety, depression, or other conditions. Do you think spirituality is a beneficial experience or something beneficial to do?
There has been some work where religious rituals have helped other standardized psychological therapies. So there is the spiritually added CBT and so on. So there is this work that has been done, and those who are the proponents of that believe that it works. And it does for those, because what it works is it deals with your inner belief system. So a spiritual person will respond to spiritually tinged therapy. Now, the problem with psychology and psychiatry is that they are in a great rush to be recognized as sciences. And for that, they want to reject all the inexplicable, unexplained other phenomena, and they want to talk away from the metaphysical and spiritual and other bits, because they believe that that's mumbo jumbo, this is all superstition and so on. But the problem with human psyche is that human psyche is full of all these things, full of spiritual ideas, full of superstitions, full of belief systems. There may be social belief systems or religious belief systems. So if 95% of the population of the world believes in some form of religion, then obviously that's an avenue where they're already vulnerable to in terms of suggestion. Now, the issue is that psychology, and because it's a totally Western, modern Western construct, and although the original psychology is not based on any science, Freud or Jung or Piaget or all that, but these were the real creators of modern psychology and therapy, they did no real science. Psychiatry is in reality no real science, because we really don't know how many things work. And it has emerged from giving people cold showers and locking them up and chaining them and cutting frontal lobes and so on, and electroconvulsive shocks. So if psychiatry is emerging from that body of knowledge, and psychology has emerged from all this narrative based and individual strong leader philosophies and theories, it has this desire to become more empirical. It has the desire to become more scientific. And as a result, they poo-poo this. They reject that. That's why what I feel is that in societies which are more traditional, in Pakistan and India and Arabia, even in Western societies which are more traditional, the role of accepted spirituality, this will help the believer.
In what ways does it help them with their?
I mean, I'll give you an example. My late mother had some, sort of, obviously she had Parkinsonism, and that was quite a debilitating thing. And so we went, after having tried and there isn't much treatment, and we went to a local in England, a faith healer. And it was a Christian faith healer, and we said, okay, let's do that. Christ is also a prophet of Islam. So, and he was a kind of, hands off or whatever. He did his chanting and whatever spiritual work. It was peaceful for her for a while, but she came out and said, well, when he was talking of Savior as Jesus Christ, because that is not in tune with the Islamic view that the Savior is only God, and in Islam Jesus is Holy Prophet and not God. That didn't really sit very well with her in terms of that. But although the thing that Jesus was named was peaceful, but being Savior, the only Savior, wasn't. So what I felt was that it was a good experience, but not entirely a satisfying experience. And so that's where I felt that had it been something more in tune with her own belief. But the problem with that is that we weren't, and she also wasn't keen on that. Because the practices that, because this was a very simple thing, it was all done in front of everybody, with the public, he was praying, and he, just did this on her arms and legs, which were affected by Parkinsonism. But the idea of going to a Muslim faith healer wasn't attractive to her at all, because of all the abuse and all the exploitation and all the bad history that comes with it. So that is why one has to be very careful, and I do not blame the psychologists and psychiatrists who want to shun it, because you don't want people, being abused as a result.
If we're talking about other kind of milder spirituality, like prayer or reading of the holy books, trying to live a moral life, can that be an advantage to people with mental health issues?
Because it is generally an advantage, and I've seen in our practice people from different faiths sticking with their faith and practicing their faith and finding solace and help in that. But if you add the therapeutic component, add the medical or the allopathic, the medicational therapeutic component to it, so it all works. So you feel more enriched physically, psychologically, and spiritually, where you feel that there is a greater purpose to your life than just to exist and earn a livelihood. And
so I suppose what it does, having spiritual practices in your life, it takes you away from the predominantly materialistic mindset of in the West, which everything is about pleasure, living for now. And if somebody's going through anxiety or depression, they can't do those things. So having that eternal perspective and bringing the eternal values into life every day can have enormous benefit, I guess.
like Rousseau suggested, that what is modern life? Modern life is just copying the neighbor. Which car do you drive, and what kind of house do you have, and what kind of job, and how much does that earn, and that's it. He says, what is the purpose of your modern life? It's extremely, and it's nothing to do with you, nothing to do with the your loved ones. You train your loved ones, your children and others, to just lead that artificial life. So I think that that's where we need to be looking at this spiritual aspect, is there a great purpose? And that's where I think your last topic of the near-death experience also plays a role, that if one is going to die and there is something beyond it and you will be judged on it, then there is a greater purpose. So the greater purpose isn't buying the most expensive shoes or buying the most expensive car. It's some different purpose. And so I think that that's where it all comes back to.